A warm welcome to your weekly health show, Health and Lifestyle. My name is Marie Yambo. Now, in our last episode, we brought you the story of 7-year-old Ian Baraka, who sustained serious gunshot injuries to his face following a banditry attack in his home in Meru County. Now, today we want to take you right into the heart of the theater where the reconstructive surgery happened, and later on in the program, his recovery. And to our first segment now, where we take you into the heart of the reconstructive surgery and where a multidisciplinary team of oral and maxillofacial surgeons took charge to reconstruct Ian's face to give him a more natural look. Let's take a look. It's early morning, September 25th, 2025. Theatre 7 at the Kenyatta National Hospital is a beehive of activity. Doctors and nurses double-check machines, adjusting lights, making sure every tool needed is ready. This isn't just another surgery. Today, they're making medical history. At exactly 8:30 a.m., 7-year-old Ian Baraka is wheeled into theatre. 2 years ago, bandits stormed his family home in Meru County to steal livestock. A bullet meant for his grandmother changed his life forever, shattering his face, his nose, his upper jaw, and the innocence of childhood. This group of surgeons, oral and maxillofacial surgeons, ENT, anesthesiologists, and maxillofacial prosthodontists have one mission today: to rebuild a young boy's face piece by piece. Before the main procedure could begin, the ENT and anesthesiology teams needed to secure Ian's airway by performing a tracheostomy, a crucial step to ensure his breathing remained steady while the surgical team focused on the complex procedure. The anesthesiologist ensured Ian was deeply sedated, while the ENT surgeon prepared the sterile field. A small incision was made on Ian's neck. Through this new passage, air could now flow freely, bypassing the upper airway that might become obstructed during the operation.
We need to prepare patients early so that they are optimal for surgery, and that has been done previously. And now here what we are doing is to anesthetize the patient so that they are not able to feel pain. They will not be aware of what is happening. We have a number of monitors there to help us, see what is going on with the body physiology of the patient so that we can correct what is needed. So we constantly monitor the heart rate, vital signs, including the blood pressure, the oxygenation of the patient, the CO2 clearance, blood losses and fluid changes. All those are things that we usually monitor throughout so that whatever that seems to be going wrong can be corrected early.
Leading the team is Professor Simon Gudua, one of Kenya's most respected oral and maxillofacial surgeons. This is a complex and groundbreaking procedure, especially since it involves a child, so the team must carefully consider the child's ongoing growth during reconstruction and prosthetic treatment. And so, before he picks up a scalpel, Professor Gudua follows his familiar ritual. Before every operation, Professor Gudua pauses to lead his team in prayer, asking for divine guidance. A tradition that speaks to his faith and humility. It's about just 10 minutes past 10 a.m. and the team of maxillofacial surgeons begin the painstaking surgery that will take approximately 6 hours to finish. Now, this surgery also involved taking some skin from baby Baraka's leg that will be grafted around his mouth. The surgery is divided into 3 major stages. First, rebuilding Ian's facial structure. The surgeons carefully open the skin around his nasal area. Here, The doctors placed the custom 3D printed titanium implant where his nasal bones and upper jaw once were. It's intricate work. Every screw, every plate must fit perfectly. Next, they moved to the teeth implants. During the attack, Ian lost most of his upper teeth, leaving him unable to chew solid food for nearly 2 years. Today, he gets them back. Next, the surgeons prepare to harvest skin from his thigh to reconstruct the nose area with a custom-made prosthesis, a dermatome, a device that slices off a thin layer of skin. The epidermis plus parts of the dermis is set to the desired thickness. The blade device passes across the donor's skin, slicing off the graft. Once harvested, it was then stitched around his nose and the nose prosthesis secured to give Ian a new natural look. 6 hours later, the final stitch is done. And before long, Ian is wheeled to the intensive care unit, where recovery begins and a new chapter in his young life starts to unfold. The long-awaited surgery for baby Ian Baraka is finally over, as doctors at the Kenyatta National Hospital give him a semblance of normalcy following the injuries he sustained during the banditry attack. As for now, doctors will be monitoring him closely to ensure that he recovers well. And on that note, we take a break, but when we are back, we're talking to the lead surgeons who took charge in the theatre, Professor Simon Gudua and Dr. Margaret Marsha. Stay tuned. A warm welcome back and thank you for staying with us. Now we want to go into the nitty-gritty of what really happened in the theatre. The lead surgeon, Professor Simon Gudua, starts by just explaining what the process was like. Take a listen.
Ian is a 7-year-old boy who unfortunately was shot in Isiolo, Meru area. So the upper lip was gone, the upper jaw was partly gone. In other words, he don't have anything in the front. The nose was gone. So the surgery was to see how best we can be able to have Ian back like a human being and also establish his self-esteem. Ian could not even face the other boys of his age mates because his self-esteem was very low. And so we had to find a way of rehabilitating him through reconstructions so that he can be able to face life and also be able to go back to school. He had actually refused to go back to school.
So why was this particular surgery chosen versus any other type of surgery given Ian's age?
This is a young boy who is growing, and we must, during the construction, we must take into consideration that there will be growth. So we cannot fix everything together. We must give a provision for the bone to expand. So that's what makes it very difficult. And so we had to discuss a lot among ourselves and with the engineer, a foreign engineer, so that we can try and see whether we can have the implants spaced out, in other words, 2 parts, so that we can separate them right in the middle to allow the bone to grow.
This was a multidisciplinary team working, oral and maxillofacial surgeons. We had the ENTs, we had the anesthesiologists. How important was their role?
So the first thing was to establish the airway. So the ENT had to come in and make sure that we do a tracheostomy. Tracheostomy is almost a semi-permanent airway, and during surgery you don't have to worry about the airway because that is established. Of course, we keep monitoring the patient. The other person who was very, very important is a specialty called prosthodontics. Those people are very, very important when it comes to rehabilitation of the bite and the midface as well. and then maxillofacial surgery.
So, like you've already mentioned that this particular surgery was to allow for Ian's, growth, because he's a child just 7 years old. But what makes it also a first of a kind? Because I'm also made to understand that this kind of surgery has not been done more or less anywhere in the world. What makes this type of surgery a first of its kind?
So the issue is, how do you reconstruct the mid-face in a child? The child, sometimes we borrow tissues from other areas, but this is a child, not much tissues, and a lot of it is required. So we decided this is the first one. We are going to do something totally different. And we had the engineer also, who is foreign engineer, had difficulties asking himself, how do I do this? So finally, through a lot of discussions, a lot of talking, and simulations, we were able to come up with these 2 parts implant for the bones and for the face. Well, it put us almost at the same level with the developed world. And in other words, they can also call us for opinion. By the way, you had a very bad case with the gunshot. How did you do it? How did it go? Do you have a follow-up? So that's a kind of communication. And it's actually collaboration.
There's a question that a lot of people are still asking me, and that is, will Ian require future surgeries, given that the implants have already been put in? And just as you've explained, the implants are also there to allow him or the face to grow. Could you explain to us further, how does the face really grow?
We have the brain which must expand, and so God provided some fissures here. So this cranium will be in pieces initially, up to the age of about 2, and then they start crossing. The mid-face is the same. These are the sutures, okay, which also expand to allow the growth of the organ. If it is the eye, we have sutures for the orbit. And then there is another suture here, which separates the frontal bone from the nose. So again, that can also grow. So these are the considerations that one has to bear in mind. Faith gives confidence. If you are a Christian and you read John chapter 15, verse 5, the Bible is very clear. Without me, you can do nothing. In other words, without God, there is nothing we can achieve. He created this cow, and he will give you the knowledge of how to manipulate the surgeries you are going to do.
Thank you so much, Dr. Mwasha, for joining us in the program. We've just spoken to Professor Gudua, the lead surgeon in Ian's surgery. And we were just talking about the role of the different, experts, you being a prosthodontist. But let's begin by you just giving us, the importance of, or at least what was expected in terms of the implants. And in this case, you're talking about the teeth implants and all that. Is Ian now able to eat well?
Yeah, so initially he had restriction of foods. He was very limited in terms of what he could eat. Many of it was either mashed or blended, meaning that it would be potatoes with some soup. The veggies had to be very, very, cooked to very soft levels. But right now, he's eating meat, he's eating chicken, he's eating fish. Actually, his variety of food is equal to any other child. Yeah, so that really now demonstrates to us that in terms of growth, he will not be limited. He will be able to grow properly because the nutrition is sound. Then the issue of speech, yeah. Previously, he really had a big problem with speaking because the tongue must rest on the palate and there must be teeth and then there must be a covering. It's your nose and lip that allow you to speak confidently with a palate and teeth. Now, those anatomical features were not there. So right now we've put for him a palate, we've put teeth, we've put a nose, we've put a lip. His speech is very coherent. He's able to speak confidently, articulately, yeah. Then his self-esteem. I mean, that child is just thriving. Eh? We look at him and we feel very joyful because the difference from where he came from, a child wearing a mask, having to walk facing down, he'd never look at anyone. Eh? Now he's able to look at you and speak with a lot of confidence.
Given the enormity of this particular surgery and even how intricate it was, were there any risks during the surgery?
Yeah, so with any surgery, there are many risks that come into place, from the anesthesia to the actual surgery to the prosthesis not fitting. So there are many aspects of it, and that is why it's a team approach, where really as a team you see to plan, you anticipate what complications can happen and try and mitigate them, which is what happened in our case. Now, other than the clinical aspect, where we're looking at the anesthesia, we're looking at the surgical risks that can come into play, is really the fitting of these prostheses. You see, we had no way of knowing that they'd be fitting precisely. But again, we're using advanced software, we're using artificial intelligence, we are using 3D printing. So we 3D printed all these before and assessed them before placing them on the patient. Yeah, so we can never predict 100%, but I must say that everything fitted to the letter, and we are extremely grateful about that.
Mm-hmm. And of course, this was a surgery that involved many of your team members. This is a chance for you to just give a shout out to them. Let us know who they were. I know there was Dr. Bandit, who actually did the marathon to raise funds for Ian's surgery.
Yeah, again, it's about the team. This work can never be done by one individual. It's really a whole team approach. You start looking at from the hospital setting, you're looking at the staff in the ward, you're looking at from the people cleaning the ward, people cleaning the clothes the patients wear, the draping that is used in theater. You're looking at the nursing care. It has been excellent, okay? Yeah, from the ward to ICU to theater. Then you look at the surgeons, you look at the theater technicians or equipment technicians, and then you look at the fact that there's funding. All this cannot happen without funds. So we must say we are very grateful also to Dr. Bernice Munyasa for running marathons with a cause, because really she was able to pay the initial deposit for the company to start manufacturing. Mm-hmm. And we thank all Kenyans who actually gave towards this cause through Dr. Munyasa's running. Mm-hmm. But we had Dr. Okiriamu, very central to this, an oral and maxillofacial at Kenyatta National Hospital, because from the emergency phase of treatment, he was involved in it, up to the final phase where we had the implants placed. We had many other surgeons, from our head of department, Professor Koech, Dr. Vilembwa, Dr. Baraza. All these are oral and maxillofacial surgeons really coming together to ensure that the outcome is favorable. Then we must mention Dr. Mutuiri at Meru Level 5 Hospital, also an oral and maxillofacial surgeon, who did the emergency phase and transferred the patient. I must now also say the chair of the board at Kenyatta National Hospital, Dr. Abbas Gulet, and the CEO of Kenyatta National Hospital, Dr. Lesiampe, they have shown exceptional leadership. For all this to happen, I must say there was leadership, that directed and ensured everything worked.
It was a long surgery. I was there in the theater 6 hours, more than just 6 hours. And there's so many things that could have happened in the surgery room and even before that. But let me ask this question. What has stood out for you in the whole process?
Well, I want to say many things stood out for me, but I think one of the most it's basic, but one of the most fundamental things that happened to him was actually his sense of smell. I mean, I watched Ian picking flowers, and smelling them, and it was so joyful to watch, because then the olfactory system has also been exposed when the surgery was performed. Because when Professor Gudua and Dr. Kiriamu split the soft tissue and opened it up, and now we have the framework, the implants, it opened up his airway. So he's able to smell. I mean, it was just joyful to watch him. The other thing, of course, is now feeding. Now he's able to distinguish, because he's chewing, so he's able to tell what's sweet, what is bitter. Yeah, just watching this child enjoy the basics of life has been so inspiring. Previously, Ian was not speaking. He used to walk with his head bowed low and, a mask all the time. And because he had lost the palate, he had lost teeth, he had lost the lip and the nose, speech was affected. But right now, he's speaking very coherently, he's very articulate. Yeah, I think that young man will soon be an actor because he acts and keeps talking with lots of confidence. It gives us a lot of joy.
Ian's post-surgery recovery has been remarkable. We paid him a visit at the Kenyatta National Hospital to just see how he's doing. Let's take a look. 3 weeks later, we visit Ian and his mother in Ward 5 at the Kenyatta National Hospital. This time, there are no masks, no monitors, just the bright energy of a young boy who's back to himself.
Andi sahi anatembea, anakula vizuri, analala vizuri, angoroti vyenye alikuwa anangorota, sahi analala vizuri. Nashukuru sana kwa madaktari, waendelee na hiyo mwito na Mungu awawekee nguvu na wapee, yani hawapee hiyo moyo.
Tumwambie Dr. Mwasha.
Wawia shanki.
A simple wish, but a powerful one. Even at his young age, Ian understands that what these doctors did for him wasn't easy or cheap. His surgery costing more than 3.7 million shillings. After the attack, Ian refused to return to their home in Meru. The memories too painful, the trauma too deep.
Akasema mimi nikienda huko Samburu inatokea watanimaliza tena, ndio ameniweka alama na kusaliwa na alama. Akasema sasa mimi sitaki kuenda huko, sasa niame huko.
For Bessie, the road has been long, full of fear, pain and loss.
Tumepitia changamoto nyingi sana. Nikaona ni kama tu hata tengenezwa atakaa hivyo, lakini mimi nikaambia Mungu, kama Mungu ni vyema uliona tupitie kwa hayo yote na hata tengenezwa bora tu ako hai.
She says she has forgiven the man who pulled the trigger.
Kweli mimi nilimsamea, ndio sijui ni nani alimpiga. Nikaambia anti serikali isimame na watu wa huko kijijini.
Ian has faced unimaginable challenges and come out stronger. As he heads back to school, there's no telling what the future holds for Ian Baraka. But one thing is certain, it's full of promise.
Kwa maono yangu Kenya anafanyanga hadi mimi simuelewi, ndio ni mtoto wangu lakini nashindwa kumuelewa. Ndio ana kila kitu, anajua hii mambo ya hii magari, kila kitu, anapenda hii magari na mandege sana, anatengeneza hadi peke yake. Sasa naona tu atakuwa engineer mkubwa ama daktari mkubwa.
Hiyo ni baiskeli.
And of course, we wish Ian all the best in his life endeavors. We've come to the end of the program. My name is Marie Ambo, and of course, thank you to everyone who made this program possible, the production team, and of course you for participating. And we cannot forget the whole team that made Ian's treatment a success. Until next time, see you again.